This unmet need for family planning is also reflected in the current use of family planning, or what we call CPR, contraceptive prevalence rate. Any method of contraceptive use is pegged at 50.7% overall method use. All methods including artificial, natural, and even traditional methods. Pero pag tinignan po natin, technically, only 34% are using family planning, modern family planning methods. Kasi yung traditional methods, as we all know, are the less effective use of family planning. Kaya we have to work on increasing the modern method acceptance of both artificial and natural family planning. Natural family planning, may modern methods na tayo, for your information. Some of the reasons for low performance in CPR, as found out in the National Demographic Survey, una, there is still a high fear of side effects of the different methods. There is a predominance of objection of husband, and husbands prefer more children than their wives. So these are socio-cultural factors, no? But these factors can be attributed to lack of adequate access to information and services among our Filipino couples of reproductive age, contributing to low use of family planning. Adolescent fertility is one area that contributes also to the increased population growth in the country. And based on the YAPS survey, the latest YAPS survey, 26% of women aged 15-24 have begun childbearing, higher among those in rural areas with no education and those who are poor. And the YAPS survey also tells us that 20% have engaged in premarital sex, which may eventually end to early pregnancies or young pregnancies. And of course, it may also result to sexually transmitted infections among our young couple, which will affect eventually the quality of lives as they are growing into adults. Other studies also show that teenage pregnancies accounted for 17% of induced abortion in the country. Going back to the RH bill, PAPCOM feels that the bill, if approved, will ensure a well-managed population growth and distribution and contribute in mitigating hunger and alleviating poverty directly or indirectly. As we believe that large population will have an impact to the other social development indicators of our population. These are manifested, large population is manifested in the number of shanties that have mushroom along the roads and waterways, or even yung pong under the bridge, particularly in urban areas like NCR. In the exodus of the rural poor to areas of urban blight, and in the long queues of the aspiring OFWs hoping to find greener pastures abroad. It is also clear that the manifestations of population pressure register themselves on the environment. Our forests bear the scars of man's intrusions, and our seas the wounds of over-exploitation. And we could also see the effect of large or increasing population in the metropolis, which has become, as we're saying, the gas chambers, and residents are the victims in the air pollution in cities and urban areas. In terms of nutrition, we are also saying that increasing population will result or aggravate the malnutrition status in the country. A government survey revealed that 3.35 million Filipino children aged 0 to 5 years old are underweight, or a prevalence rate of 26.2%. And malnutrition is strongly related to malnutrition because of the capacity of families, particularly if there are many children in the household, that would affect their purchasing capacity to purchase more nutritious food, and the allocation of that food to more number of children in the household, and this is aggravated particularly if that household have low income. A growing population also has an impact on education in terms of more needs or demands for classrooms, textbooks, teachers, and the effect of which is to the quality of education in the country. Again, the RAGE bill will operationalize the guiding principles of respect for life, responsible parenthood, birth spacing, and informed choice. These are the policy principles of our present administration as far as population policy is concerned. Given all this situation of our country, we're hoping that the approval of the reproductive health bill and all the other related bills filed in Congress, which hopefully will be consolidated into one comprehensive reproductive health bill, will contribute to our vision of well-planned, happy, healthy, prosperous, and empowered Filipino families in the whole country. Maraming salamat po.